Hello, my name is Eileen Abbott and I am a Jefferson College student, and today I would like to present my topic for my health policy paper. My topic involves the nurse's role during a DNR A and D discussions, and that is do not resuscitate and allow natural death. Those terms sometimes are used interchangeably during discussions regarding end-of-life care. As an inpatient nurse, I have been part of these discussions, and even sometimes I have initiated them and brought it to the physician's attention that these type of aspects of care need to be discussed. However, during my research on this topic, I have discovered that that is not necessarily the case in many institutions, and that physicians feel like nurses shouldn't have a part in these discussions due to the in-depth decisions they have to make regarding care. And sometimes I guess they think the nurses may not be able to answer all the questions or explain things thoroughly to make sure that the patient family understands. Per the ANA, nurses are responsible for advocating for their patients to ensure they do not suffer during the dying process. Patients' wishes should be known in advance if possible so that the nurse can advocate and speak up for the patient on their behalf if they are not able to. There are many options surrounding end-of-life care and resuscitation, so that's why it's important to initiate these conversations sooner than later to help prevent some of that pain and suffering. And it's also a lot easier to discuss these things before they happen than in the moment when it is an emergent situation. I personally believe that nurses should be able to initiate these conversations and lead these conversations. They also should play a part in writing the policies and procedures for the facility that they work in. If a nurse does have a patient and she is uncomfortable having these conversations with a patient or family, then that patient's care should be transferred to a nurse that is more comfortable and more well versed in the language regarding end-of-life care and resuscitative measures. Nurses also should have access to education and training on these situations, and should include like a simulation lab to where they can practice, videotape themselves and watch it back to see how well they do and where they can improve and where they need to read up more on research and things like that. Some of these changes are going to take time, and also with any change they will be met with resistance. That's with any change. The big key here is going to be just education and support amongst staff to help facilitate these changes and provide a smoother transition into adding these into your bag to help families at the end of life discussions. All right, thank you.